Good morning and welcome to Public Health and Minority Health Disparities Subcommittee. Today is March the 13th, and we have 3 bills on the agenda today, two that are carryover, one additional that Delegate Kaiser has been working hard on. So we're going to start with House Bill 980. Just as a reminder, yesterday we did vote the amendments, but we had one sort of outstanding question. So we're going to vote the additional amendment and then the bill. Aaron, if you can walk us through, just to remind us about the bill and the amendments and the addition that we have, and then we can take it up for conversation.
Okay. The bill as amended would require the Secretary of Health within 6 months of receiving specified findings from the Opioid Restitution Fund Advisory Council to present to the council the decisions of allocations from the fund. The department must also post to their website their findings and recommendations and the Secretary's decisions. The bill expands the permitted use of the Opioid Restitution Fund to include supporting community-based nonprofit recovery organizations that provide non-clinical substance use recovery support services in the state. The bill as introduced would have required 25% of the fund to go towards opioid use recovery support services. That was stricken by the bill. So those were all of the amendments that were discussed at the last subcommittee. The bill is introduced also required that by November 1st each year, any political subdivision that receives opioid restitution funds must report to the Secretary on the amount of the money received that was expended during the preceding year and how the money was spent, and post that report on the political subdivision's website. So the amendments that were outstanding that are before you today in the reprint cut that language that I just read that would have required the political subdivisions to report November 1st each year, and instead require that on or before December 1st, 2024, the Maryland Department of Health will examine and report the best process for making all of the expenditures of all opioid settlement agreements by state, county, and municipal governments accessible to the public.
Thank you. And my understanding is that this amendment was a consensus amendment between MACO, the department, and CADD. Is that? I see a lot of yes. Head nods. Anyone want to be heard on this? All right, I heard Ann Seacott say yes.
Just thanking everybody for their work coming to agreement on the bill.
Thank you so much. Can I have a motion on the amendment? Delegate Rosenberg.
Move favorable.
Second.
All right, it's been moved and second. Any further discussion on this amendment? All right, all in favor say aye.
Aye.
Anyone opposed? Go ahead and raise your hand. And all right, Delegate Rosenberg.
No, I thought that was an aye to vote yes.
All right, perfect. Thank you. Can I get a motion on
the bill as amended?
Second.
All right, it's been moved and seconded. Any further discussion? All in favor say aye.
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 Anyone opposed? Go ahead and raise your hand in the chat. Thank you, everyone. House Bill 980 passes unanimously. All right, we're going to move on to House Bill 1051. This is the Maryland Maternal Health Act of 2024. We've had a couple of days of discussion, but we were just waiting on the final reprint of the amendments because we had some outstanding questions. So, Aaron, if you can walk us through the bill and the outstanding work that has been done on the amendments, and then we will open it up for discussion.
Okay, the bill requires a provider who receives reimbursement from Medicaid for obstetric services to complete a prenatal risk assessment form for a patient, and also birthing facilities where an infant is born must also complete a postpartum infant and maternal referral form and submit the form to the local health departments. The Secretary of Health is required to develop a Maryland report card for birthing facility maternity care for each birthing facility in the state. We discussed this yesterday, some of the outstanding issues that are in this most recent reprint. If you look on page 5 of the reprint, and I'm pulling mine up. Sorry. Page 5, lines 22 and 23. This goes to the report card for birthing facility and maternity care, and it specifies that the report card will include the following information for each birthing facility that is disaggregated by race and age, and this is the new language, in accordance with best practices for data suppression. Then there was a study in the bill when it was discussed yesterday on severe maternal mortality that the department felt was duplicative of current work that they're doing in that area. So that's been stricken. That was formerly Section 3. If you look, there's also strikes references to MD Mom, which was discussed in the reasoning was discussed yesterday. And then if you look on page 6 of the bill on line 27, under the requirement that each hospital and freestanding birthing center participate in the severe maternal morbidity surveillance and review process, they must also study quality improvement efforts of hospitals and freestanding birthing centers regarding SMM based on the reviews.
Thank you, Erin. And just to clarify, the best practices for data suppression speaks to the question of if we have age adjusted, sometimes those subsets are too small and you would actually be able to identify based on that. So that's, yeah, Delegate White Holland is nodding her head. Can I get a motion on the amendments?
Move the amendments.
Second.
All right, they've been moved and seconded. Any further discussion? Anyone want to be heard on these amendments? Thank you, everyone, for all your hard work. And all in favor of the amendment, say aye.
Aye.
Anyone opposed? Go ahead and raise your hand in the chat. All right, on the bill as amended.
Move the amendment. Move the bill.
Second.
It's
Second.
been moved and seconded. Any further discussion on the bill? Seeing none, all in favor, say aye.
Aye.
Anyone opposed? Go ahead and raise your hand in the chat. Thank you once again to all the stakeholders and to Delegate White Holland for your excellent work on this. And we are going to turn to our last bill of the day, which is House Bill 1304. This is the Maryland Department of Health and Department of Aging Earned Income Tax Credit Distribution of Information. We have not had this in the subcommittee yet. But Delegate Kaiser has been working hard to get some consensus. And Erin, if you can talk us through the bill and the amendments.
Okay, there's a reprint on this bill, and these reflect amendments that are being offered by the bill sponsor, who's Delegate Kaiser. The bill as amended would require MDH to develop a process to provide information about the availability of the state's earned income tax credit to individuals enrolled or participating in the Maryland Medical Assistance Program, Maryland Children's Health Program, Qualified State Long-Term Care Insurance Partnership, and Senior Prescription Drug Assistance Program. The provisions in the bill is introduced related to Department of Human Services programs have been stricken, and instead it adds language that would require the Department of Aging to develop a similar process about providing information about the availability of the state's earned income tax credit to for the Maryland Access Point Network, and would also require the Department of Aging to provide training regarding developing the process and providing information to Maryland Access Point Network employees.
Thank you, Erin. Delegate Kaiser.
Thank you, Madam Chair. Thank you, Erin. And then just to everyone on the subcommittee, my goal was always about when people in need go to our state agencies, that they are then told about the earned income tax credit that could be worth thousands of dollars and they might not know about it, and that these are essentially all access points for people. And so it was originally drafted as explained, like sending something out to every enrollee, and I never meant that. It was always about when people are calling or in person or online on the phone and just like, hey, you're getting this. Hey, let me tell you about this. Everything else was described. I love the amendments. I do know that MDH is fine with the change language. I assume that someone is there from the Department of Aging. They want D1 deleted, Erin, of D1 and D2.
And I
And
see Ms.
I mean,
Nunez is here and nodding, so.
yes, so that's what they wish, and I'm okay with that. I also told her when we spoke a little bit ago that I'll work on D1 with them over the interim, but for right now, I'm glad to go with what they want and strike that piece of it.
All right, thank you. And Delegate Kaiser, do these amendments address the fiscal note?
Yes, I mean, because it was originally about mailing out to all the enrollees, and that was, again, never the intent to send out a blast email or send out mail. It's just about when someone, again, is like right there in front of you, hey, let me tell you about this other thing. So yes.
Perfect. Thank you so much. And Aaron, you caught that that additional change?
I'm not, so Delegate Kaiser, we're cutting everything related to?
Oh, no, just D1. There's a section there.
So
There's
they just have to provide training, periodic training.
yes.
That's what remains, just providing periodic training. Okay.
Hopefully Andrea's nodding again.
And she is, and I'll call on Andrea before we take the vote to make sure that we're clear on this. Let me go to Delegate Riley. Did we answer your question? Okay, Delegate Rosenberg.
Delegate Kaiser, thank you, Madam Chair. Isn't it fair to say this is like what we do at motor vehicles in terms of voter registration? You're coming in contact
Yes.
with the government.
Yes, and in fact, the reason why I struck Department of Human Services is when I met with them, they do exactly what I wanted at all the places people touch and talk to them. So yes, thank you for that, Delegate Rosenberg.
Pleasure.
Thank you. And I can see from the co-sponsors, this is a very popular bill. Ms. Nunez.
No, I'm just here if there's a question. We appreciate the collaboration with Delegate Kaiser. Yeah, we're fine with Aaron. I can email you separately confirming. We're fine with what she said. D2 can stay in. We're comfortable with that. We can do that without any new resources, I'll add. D1, we're less comfortable with. So we appreciate that coming out in the that latest draft amendment. So yeah, just here if anyone needs on a question.
Thank you
Move
so
the
much.
amendments.
Move second.
All right, amendments have been moved and seconded. Any further questions, any further discussion? All in favor, say aye.
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 Anyone opposed, go ahead and raise your hand. On the bill as amended, can I have a
Move
motion?
bill.
Second.
All right, it's been moved and seconded. Any further discussion? All right, all in favor, say aye.
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 Anyone
Aye.
opposed, go ahead and raise your hand in the chat. All right, House Bill 1304 passes unanimously, and that ends the work of this subcommittee today. Thank you all for being so flexible. We will see you on the floor and try and get some coffee and breakfast before we all have to meet again. Can I have a motion to adjourn?
Move to adjourn.
Second. It's been moved and seconded. We